with regards to availability of blood in the country or lack thereof. Now, we've established that owing to coronavirus and a lack of donor funding, we are struggling in terms of getting those units. What's your take on that? And perhaps what can the Ministry of Health and other players do to improve the supply of blood to those who badly need it?
Morning, Dr. I hope you can hear me.
Mm-hmm.
Thank you so much. I'm sorry I've been late.
It's okay, it's okay, it's okay.
What I'd like to urge Kenyans and each and every one of us is we have to, be our neighbor's keeper, as the good book says.
Okay.
And the only way we can do that is by donating blood to save a life.
Right.
We have to come and join hands, as we've always been doing since independence. So let us always have time. I always challenge people nowadays, on your birthday, donate blood.
Mm-hmm.
If you cannot be, like us who've donated over 60 times, donate blood on your birthday. And I think this will bring a big difference in our country, because we really have a shortage of blood in the country. Mm-hmm. And we have to come out as Kenyans tusaidiane sisi wote.
Mm-hmm. And perhaps some of the reluctance that we see from people who would otherwise be donors is the fact that perhaps they don't have faith in the fact that this blood that they're giving will be put to the right use, it won't go bad, and things like that we often read in the press. What would you hope to see in terms of management change so that we are having a well-oiled machine from the donor to the person who needs it?
As a developing country,
yes.
At least Kenya, since if we look back since the bomb blast, we've made strides, and it's through technology, and as a country, we are getting there.
Right.
It takes time, yes. Mm-hmm. There may be difficulties here and there, but as a country, Kenya, we are taking the right direction. Mm-hmm. We have a new CS, Mr. Kago.
Yes.
He's doing so much, and with the advances with technology, the refrigeration of blood and all that. And once all blood centers are opened in all the 47 counties, mm-hmm. there'll be a difference. Mm-hmm. There'll be a good difference, because now at least, because we have satellite centers. But once we have those fully running blood banks in the 47 counties, I believe as a country we'll have enough blood for each and every one of us.
Okay. Mr. Mwangi, would you chip in when it comes to the fact that the coronavirus has made the reserves quite depleted? Speak to me about the fear from the people that I don't want to go to hospital because, of course, I don't want to be infected by something. I don't want to go to these facilities for fear of exposure. Could you speak to that, and what advice would you give to people so that they might regain their confidence in terms of giving blood?
Okay. It was hard during the coronavirus.
Which is still happening.
Okay, what we are experiencing right now, the situation on the side of the blood services is, I think it's worse than corona. So, if we are below 20%, we need to wake up. We don't have to fear. Right now, we have to stay with corona.
Yes.
We go, as we follow the measures, we just go and give the blood.
But from your experience, could you speak to the safety that and the measures that are being put in mind and implemented at the centers so that people can actually know that they will be safe?
Okay, the Ministry of Health has done everything to make sure you are safe. So when you are when you are donating the blood, every measures are being taken care of. Not only the COVID-19 measures, but everything concerning health is being taken care of. Yeah.
Okay. And Ms. Aisha, what would you advise people in terms of this crippling fear that makes them stay away from the centers?
I'm glad that Dr. Nduku, she's the current National Blood Transfusion Director.
Yes.
We've been having some meetings because I wanted to have a blood drive. And she told me there are some guidelines they are making because of the COVID, and now they are done. That's why we are doing the first, in fact, it's the first blood drive during COVID on 12 to 14.
Yes.
But last year, when almost the COVID started, we did a blood drive. There was an interfaith blood drive I organized in the 7th and 8th of March. And we got like 152 pints of blood. So people, regardless of the COVID, we have patients who need blood.
Yes.
And it's important we continue to donate blood and see that no Kenyan is dying because of lack of blood.
Yeah.
Yes.
It's very important. That's a very important thing that you've raised. The fact that we are having a pandemic doesn't mean that mothers and children and people suffering from diseases such as cancer are not actually getting are not done away with. These conditions are still there and they're still among us, and therefore donations must be maintained. Mr. Sanya, we are experiencing, part of the reason we are experiencing this shortage is because there is a lack of donor funds, or a reduction in the funds that are behind blood donations. So in your view, what can we do to build this? Should we be shopping for new partners in terms of donor funds so that this can be a thing that is supported? Or how should we move towards ensuring that there's more and more supply for the people who badly need it?
I think the best, what I've seen, what I believe, as a country, I think we're enough. But if we can get the students, if we can ask the Ministry of Education, because that's the best reservoir as a country that we have. Because I remember when I started donating blood, I was in school, in secondary school here for Kumani High School.
Yeah.
And if the national government can partner with the Ministry of Health and the Ministry of Education, I think we can get on very well. In fact, we'll get an oversupply of blood, I believe. Getting the students would be the best.
But I would imagine that is already the biggest donation demographic, if I can say that. Ms. Aisha, most of us first gave blood at school. So is there another part of the population that we should be looking at and trying to tap into that isn't giving? Perhaps people above 50. Yourself, you're above 50. You donate. Is this a group that needs to be targeted as well?
I started donating when I was in school.
Yes.
So I'm sure you should start, you groom yourself. So when you start when you are young, because I believe nobody at 50 now, at 50 will start donating blood.
Yeah.
So I think we should concentrate on the youth also. When we groom them, and I'm glad to say that I have my son who is 25 years old. And he started donating when he was in Form 3 also. And so far he has donated 12 times.
Right.
So I can see the importance, and everybody should start, like me, I started with my son. You start with your brother or your sister, because we don't need only men to donate.
Yes.
Even ladies. In fact, we are the most strong who are there. You see your child dying because of no blood, so you should have that heart to see that, let me donate and see that nobody is dying because of no blood.
Right.
Yes.
Mr. Mwangi, what's your idea of how we can actually increase those numbers, or rather perhaps inculcate that culture from that point of high school? Is there another group we should be targeting, or should we just be, moving with the generations and maintaining it?
Okay. COVID-19 taught us a big lesson. There was no schools.
Yeah.
So if you target the student, you can get them. So it's time now to look for another way.
Diversify.
So that we can, anything can happen. We saw it. Anything can happen. So it's the time we form like the groups we are forming, then we join hands and we come up with the solution.
Absolutely. And Mr. Sanyas is joining us via Zoom. He's talked about, forming communities. He's part of the O-negative community that is actually has come together, and of course they look to each other for blood donations for everyone, or perhaps for each other. Then we have Ms. Aisha, who has been donating since 1981. Tell us your story. You are seen, you also, I'd say, a veteran blood donor. Tell us your story. What is behind this motivation, and how would you encourage people to be a part of it as well?
Okay, like I think all of us, most of us who have that foundation in blood, we started when we were in secondary school. And I remember it was my colleague who came with a Fanta, a soda.
Okay.
It was during these exam times, so we were not basically in class. So I was reading my novel, James had chairs of a Fanta. And then he comes with a soda, then I'm like, soda.
Yeah.
I was like, you too. I put my James had chest out, went to the biology lab where they were doing the blood donations.
Right.
And that's how I started. And I think that motivation, since then, when I realized there's no big deal, you donate blood and you're well. And it has health benefits. And since then, I've never looked back.
Yeah, and there's of course I've talked to our guests here before you came in about the fears that surround donating blood. Some people do not want to know or be diagnosed with a certain problem because they have to make sure you're healthy before you give blood. And at the same time, some people don't believe that you can maintain a normal, healthy life if you give blood as often as people such as yourself. So what would you say to those fears that people have in terms of perhaps they'll discover I have this and that disease, or at the same time, perhaps I might just be weak, I might faint, something might happen to me when yeah, so please address those fears.
I think, number one, the fears are unfounded. It's not true. If anything, whatever condition, if there is any underlying condition that you may have, it will be more beneficial to you because you'll know it early, and you'll get the necessary treatment that is needed. Otherwise, in fact, I always tell people, once you donate blood, it's kind of a medical health check. In fact, it's the government which is paying for you at no fee. And if you go to a private hospital, you'll pay a lot of money.
Right.
So it's good to know. And they'll always advise you whichever way, whether it's good or bad. But they'll give you the way forward of how to handle any situation that you may be having. So it's always good. I always donate 3 times in a year.
Okay.
And through that, if in case there's any medical condition that I may have, I'll always be advised by the personnel at the blood donor center of what to do and the way forward. So it's a benefit to you. It's a you should not fear.
Yeah.
I also feel it
Yes.
But overall, it's something very nice. There's nothing bad.
Okay.
Those fears are unfounded.
Yeah, and Ms. Aisha has also talked about how she uses social media, and of course there's the Damu Sasa app. What is your take on the use of online platforms to marshal support and of course get people going in terms of donations?
It's very important, and you'll also capture a big number of people. I've also joined the Damu Sasa, and we also have WhatsApp groups. When somebody needs blood, we share. So it's also a benefit. It's really helped. Even on Facebook, when there's a crisis, we always put the information forward, and imagine you'll always get a response in the country. We've never been let down whatsoever. Hakuna siku tumepata aibu yoyote.
Okay, Mr. Mwangi, talk to us about your view of social media platforms as a way of getting people to donate, and at the same time, perhaps the people who are watching have no idea where to get this app, Damu Sasa. Could you explain to us how people can actually find their way to this app and, of course, learn and benefit from it?
Okay. through social media, it's easy to access information. Okay, we have that Damsasa application. You can get it from the Google Play. Then you download, you register.
Okay, it was short and sweet. Ms. Aisha, I do believe you had a point you wanted to make.
Yes, I wanted to tell Kenyans that they should have this culture, a routine to donate, because you see, when we have a tragedy, like when we had the Westgate, the Dusit, the bomb blast, when you go donate, people go in huge numbers to donate. But remember, somebody is critical somewhere, waiting for the blood. So normally, somebody would lose life because the blood did not reach in the safe time. So what I'd urge my fellow Kenyans, we have that.
Before you get into that, please explain to us the lag time between a person donating and it getting to that person. Why wouldn't, because some people might assume it will go from me and directly to the person who needs it.
No, you see, when you donate, the blood has to go for screening to be seen that it is safe to be given to the patient. It's not just go, it's been bled and taken there. So there is a procedure.
And how long would this take?
You see, my brother Sanya said that there are some tests which are being done because it's been HIV, hepatitis, STIs, whatever. And you know, it's a process.
Yes.
So you can imagine that process, even if maybe it's like 4 or 5 hours, the patient needs blood there and then.
Yes.
So what will happen? The patient would die. So we need to have blood waiting for. We don't expect people to be sick, but at least blood should be there. In 2019, I got an opportunity. I was invited in Rwanda for the World Blood Donor Day. And I had an opportunity to be taken to the blood bank in Kigali, and bloods are there, waiting. So I'm hoping that Kenya will reach there very soon, and it needs me, you, and others to get that blood to be stored.
Okay.
Yes.
Yeah, we need to have sufficient reservoirs for blood. Now, Mr. Sanya, speak to us about the access to these facilities. Perhaps someone is watching at home, they don't know how to start. Is it a hospital? Are there special centers? The Red Cross facilities? How can someone get out if they're not a student that would be waiting for the Red Cross people to come to them? How can they access facilities where they can give blood?
True. The most referral hospitals at the country level always have an office where, a department where one can go and get blood.
Yes.
And also the Kenya Red Cross. So just avail yourself at any Kenya Red Cross office or any hospital. You'll always be directed. Because since we have a shortage of blood in Kenya, there's no way anyone will ever be turned away. Ukijitoa tu nataka kutoa damu. Never ever. So just walk to any hospital, any public hospital, you'll always get assistance and the direction of what to do and how to donate the blood. We've never ever taken somebody back, never ever. We need that blood as Kenyans.
Okay, and Ms. Aisha, I do believe you wanted to add to that point?
Yes, as I said earlier, we have Damusasa,
yes,
the app, and also we have we need like to do awareness on blood donation and the centers, and also like in Nairobi, I wouldn't want to see a vehicle from Machakos or Kajiado to come to Nairobi to collect blood, because blood comes from a human being.
Yes.
We have human beings in Kajiado, in Kiambu, in everywhere. So we need to have like blood drives in each county for it to have its own blood. But as in Nairobi, we normally have referrals, people coming from other counties to come for treatment. That we can work on it. But no ambulance or only vehicle should come to collect blood from Kiambu or from Kajiado or from wherever, the nearest, yes.
Absolutely. And Mr. Mwangi, do you think more could be done to ensure that the blood banks are closer to certain cities or towns, or, you know, so that we're not seeing that zigzagging or crisscrossing between county lines? What do you think could be done to ensure that doesn't happen?
Okay, as Ms. Aisha said,
Yes.
we need to have blood banks in our counties. So that when the blood is needed and the patient is on the county hospital, he or she don't have to wait until the blood is taken from Kenyatta Hospital to the county hospital. So what we can do is to have a blood bank in our nearest health cares.
Okay.
Yeah.
Okay. And Mr. Sanya, you're hearing the comments about people being referred to another hospital or an ambulance having to rush to another county to bring blood. What is your take on that, and how better can we work that out?
It's true. It's so sad when you find, like, in Nakuru, we have to wait blood from Nairobi to come to Nakuru. I think we should, as Kenyans, take care of our neighbors. And your immediate neighbor is the person who is in your county. And we can only do and avoid such scenarios when each county, I think the leadership in each county should now come out and take a step so that the residents of that, whichever county we have, are encouraged to donate blood at whatever schools, colleges, and those who are working, and those who are also not working, the business community. Let us all come out through churches, you know, when there are gatherings. Let us have a blood drive, not only for other issues, but to save a life. When people are gathering, like during this Valentine season, in Nakuru, and I think in Nairobi and in Nyeri also, the blood bank, the hospitals there have come out to encourage the residents of those counties to come out and donate blood. So it's encouraging, and let us, at the church level, let us also have, like we have Easter. The churches can also have a special day in the country, you know, for people to donate blood on that particular Sunday. The mosque on that particular Friday, you know, something like that.
Okay. Now, I'd like you all to give your closing remarks on this matter. I'll start with you, Mr. Mwangi.
Sorry?
Your closing remarks.
Okay. What I can tell the community is to show love, particularly on this weekend. Go donate your blood. It's just a pint once, and you will show your love to your loved one and to the patient.
So that's a way of giving, particularly in this Valentine's season, giving of yourself. Ms. Aisha.
Yes, I'm urging my fellow Kenyans. I'm donating my 67th time, and I urge you to come and be with me and come and donate, because we need to save lives. And to my fellow women, you know, we are the most people we have our children, we have our husbands, we have our mothers, we have our fathers, so we are the ones who are in care. So we don't need to see people dying and crying. So you can donate and cry a little, but not cry. So please have that culture of donating.
Right. Yes. And Mr. Sanya, your closing remarks?
Let us show love, let us save lives. And Aisha has talked about the women. Let me talk about the men. Able to take control. Let us be the number one as we are doing. I wish you well, and God will bless Kenya. We are a great country, and it shall be well.
Okay.
Thank you, madam.
Okay, and as we close the conversation, I'm getting a question here where you can get a donor card. Perhaps you could explain it again, Ms. Aisha. A donor card, how does one get one?
You see, when you go to Kenya National Blood Transfusion, when you go donate, you are given a card. And that card shows that you've donated.
Yes.
And when are you supposed to donate the next donation?
Yes.
You know, people sometimes they don't understand. You see, when you go and donate for a relative, you've not donated for, it's not for the Kenya National Blood Transfusion. Maybe you go to a certain hospital and you just donate. So when you go and donate with the Kenya National Blood Transfusion, there is where they have the bank.
Right.
And they'll recognize you. When you donate and you have a patient, when you need blood, National Blood Transfusion, they'll give you blood. But you see, when you go and donate for a relative, you donated for a person.
Yes.
Not for, it's not that you've gone voluntarily to donate.
You're not contributing to the National Reserve.
Yes.
Yes. Thank you very much. That is Ms. Aisha Dafala, a leading female donor in Kenya. She's been giving blood since 1981. That should serve as a challenge to you. And we were also joined via Zoom by Mr. Kennedy Sanya, also another leading donor in the country, as well as Mr. Peter Mwangi, the founder of a leading blood group O negative community. You can reach out to them online and of course get the app that we have just talked about and get yourself to be a part of the giving community. You can give your blood and celebrate in a special way this coming Valentine's. We are going to take a short break. When we come back, we're going to have some stories awaiting you from both the local and international spheres. Stay tuned to Morning Express.